Hey guys, just wanted to have a quick chat with you guys today about sciatica. Very common presentation to us here at PRP Physio, and probably a lot of problems that cause people to lose a lot of function, high severity symptoms, and can really be quite an irritable presentation. Doesn't necessarily always occur with lower back pain, but probably is more common to occur together. Sometimes it may or may not correlate directly to the back. I would say quite often a lot of people have tightness, stiffness through the hip that can be causing those sciatic symptoms as well. So a really good clinical hands-on assessment is really needed to be able to properly diagnose where is that sciatic nerve irritation coming from. So I would say true sciatica presentation should be occurring with pain traveling down the back of the thigh along that sciatic nerve pathway. Can correlate with some pins and needles or tingling. I'd say often a lot of people describe it as a burning pain or these sharp shooting sensations that can come and go. Typically, I would say more often than not, people are reporting acute onset of low back pain, and then probably maybe a day later, they are reporting the onset of that sciatic pain, slowly sort of traveling down the hip into the back of the leg. So in terms of a hands-on assessment, what you're looking for is neural tension tests. So there's two common ones that we do here at the clinic. So one is called the slump test and the other is a passive straight leg raise. So they're assessing for tension of the neural system. So we can put different areas of the nervous system on stretch and on tension to help try and determine where is that source of tension coming from. In terms of imaging, I wouldn't routinely send for imaging or advise imaging in the early stages. More often than not, I would say most cases are going to respond to good quality, targeted hands-on treatment following a good assessment. If we're really looking for something that either is just not responding the way we think it should, or there's other symptoms that are starting to creep in, like some numbness or some foot weakness or something along those lines that seems out of the ordinary, then we may go, okay, look, I think it might be time to go see a GP and potentially have a look at something further, like an MRI, to see is there something that is potentially causing a neural compression. And so I would argue that there is a little bit of difference between a nerve compression and a nerve irritation. I would say most people presenting with sciatic symptoms are more of a nerve irritation rather than a true nerve compression coming from the back. So there are quite specific neurological tests that we would perform to determine is there signs and symptoms of a nerve compression issue. And they would really sort of be done in most cases just to confirm that that isn't a potential source of symptoms. Exercises, there's a lot of different pathways you can go down. Stretching, keeping mobility through your muscles to take that tension away from your hip or from your lower back. Trigger point balls, foam rollers can be really, really useful. In most cases that aren't highly irritable, nerve gliders can be really, really handy. They're essentially a way to try and build that nerve length and nerve mobility. So the easiest way I like to think of nerves is like a garden hose. So if you buy a hose from Bunnings, it goes perfectly from the back tap to your front garden. And so if you think the back tap is the lower back, front garden is the foot. If you start walking that hose out and you get around the corner and then your husband or your wife decides to stand on the hose, that hose isn't going to be able to go all the way out. Now, if I kind of just yank on that hose or if I pull on that hose and I hold it, it's really not going to be great for the hose. Whereas if I can take that tension away with some muscle release work, some stretches, some trigger point work at home, some heat packs, I can glide that nerve out a little bit more. And over time, it's not going to be a magic fix overnight, but it's about slowly building that muscle and nerve length back up. So realistically, I'd say in most cases, hands-on treatment is going to get you better. It really only is a small percentage of cases where it's not going to respond the way that we expect, and then we go, okay, do we need to go down the lines of imaging? In terms of pain relief, best person to talk to is GP or your local pharmacist. Just discuss potential interactions with anything you are currently using. But pain relief can be really, really useful in those early stages to help reduce that irritability back down so you can get a little bit more out of your exercise program. Any dramas, any questions, drop something in the comments or shoot us a message. Otherwise, have a great week, guys.